Hello,
Hi,
how are you?
I'm good, thank you.
So, my name is Dr. April and I will do your exam for today. Can you please
Okay.
confirm the name and date of birth?
Yes, I'm Diana.
Okay,
Date of birth, 1st July, 1993.
1993. Good. So, I will get some medical records now. Can you please tell me if you have any allergies?
No,
No. Are you taking any medications right now?
no.
And do you remember when was your last exam?
I think a year ago.
A year ago? Good. Do you know when was your last dental exam?
6 months ago.
6 months. And everything was fine?
Yes.
What about your last gynecological exam?
1 year and a half.
A year and a half.
Yeah.
And did you notice in the last months or weeks any itchiness, any redness on your body?
No.
No? I forgot to ask you, did you have glasses or contacts?
No, only as a protection when I'm using PC.
Okay. Good. What about your ears? Any problems with your ears, with your hearing?
No, everything is fine.
Good. Any flu-like symptoms in the past 2 weeks?
No.
Or sore throat? I know it's the season now.
Maybe a little, like an itch.
Itchy?
Yeah.
Good. Did you notice any changes in your balance?
No.
Good. Are you following a special diet?
No, just trying to eat healthy, but
Okay. Do you drink alcohol?
occasionally.
Occasionally. Do you smoke?
Yes.
Any surgeries that you had in the past or 10, 15 years?
17 years ago.
17 years ago. And what was that for?
Something on my stomach, but I need to check to tell you exactly what was the problem.
Okay, but do you feel good now? Do you still have stomach problems?
No, everything is fine since then.
Good. So then today I will do a head-to-toe assessment because you said the last exam was
A year ago.
a year ago. And I'm also going to check your throat to see if you have any redness or something else, okay?
Okay, that's great.
Do you have any pain right now?
No.
No pain.
No.
Good. Any headaches, migraines?
Headaches sometimes, but it's not very frequently.
Okay. And actually I think that's it. I have everything in order here. So I will start the exam by taking your vital signs first, okay?
Okay.
Good, Diana. So this is going on the index finger. It will check your oxygenation and the heart rate. Let's see. It's 96 percentile of room air and the heart rate is 90. That's normal. And I'm going to check your temperature. So this is going inside the ear. Let me turn it on and just relax. It's 98 in Fahrenheit. Can you please turn your head this way a little bit to check also? Here. It's almost the same. So you don't have any fever. That's great. So if that's okay with you, I will check your heart and lungs.
Of course.
So just breathe normally, please. Take a deep breath in now. Going to check your back. Take a deep breath in, please. One more time. Okay, that's very good. So I heard just S1 and S2, no S3 or S4, and I didn't hear any wheezing or any infiltration of the lungs. That's very good. I will start to check your face now, and I want to palpate to make sure the lymph nodes are not swollen and to check inside your mouth, okay?
Okay.
So I'm going to put my gloves on, and I will start the palpation. Okay. So just relax. I do feel here a little bit of swelling, or mild swelling maybe. Maybe I think it's normal if you have some itchy throat. Yeah, right here.
Mm-hmm.
I do feel the lymph node. Do you have any pain when I'm doing this?
No.
No? I'm also going to check behind the ears and in front of the ears. Let me know if you feel uncomfortable. I'm going to check your thyroid as well. Okay, try to swallow now. Good. Good. So everything is looking very good. And let me check your face now for symmetry, your color as well. It's very normal and appropriate for your age. Your face looks very symmetric. Good. Let me check your sinuses. How do you feel this?
I like it like massage.
Okay, so it's not bad. What about now? Any pain?
No.
Good. Can you close one ear and breathe through the other one? I just want to make sure you don't have any obstruction. I think I do hear a little bit of blockage, right?
Yes, here.
Okay. better now?
Yeah.
Good. So let me take my pen light to check inside your mouth. Okay then, so open your mouth please. And try to stick your tongue a little bit more. Say ah. Good. So your throat is a little bit red, but I don't see any white spots, so no infection. Let me check inside to check your teeth, your gums, and to check your tongue. Okay, tongue looks good, it's pink. Also teeth look very good and gums are not swollen. I think that's very important.
Let's hear that.
Yeah, so let me let me tap around your face to make sure everything is good. Any pain or discomfort when I did this?
No.
No? I will take some measurements of your head and of your shoulders. $19. Good. Let me check here. 17. Good. And I would like to check your taste and smell. So please open your mouth, stick your tongue, and tell me what do you think it is?
I feel it's sweet.
Yes, can you describe what do you think?
Like sugar taste. Not really specific.
Good. So let's see how is your smell. I know it's a little bit obstructed, but we can try.
Mint. Peppermint.
Peppermint, exactly. And I have one more.
This is more like lavender.
Yes, it is. So that's very good actually until now. So I'm going to check also your eyes and your ears. So you said you do have some glasses.
Yes, but only for protection.
For protection.
When I'm working at my laptop or PC.
Okay. So I have a book here and I would like you to read a few words to see also how do you see the letters, okay?
Okay.
Okay. So
Your emotional response is your fault and responsibility. If you realize that, you'll have the power to control it.
okay, very good. And now I have also the Snellen chart. Can you extend your arm, please? Keep it in your hand, maybe like this.
Okay.
Yes. Cover one of the eye. Just cover it. And tell me, what color do you see here?
That's red.
Here.
That's green.
And read this row.
FPH.
And what about this one?
OLCG.
Good. Now switch, please.
The same distance?
Yes.
Okay.
And read this row.
DHGBS.
And what numbers do you see?
20 and 30.
This is 40 actually.
Oh.
Okay, read one more time. What numbers do you see here?
20 and 25.
Okay, that's better. What about, just read the last row here.
Okay. A, B, T, C, and O.
Okay, you missed a few.
So
Let,
maybe I need glasses.
yeah, I think maybe you should go to see an optometrist one more time. Maybe you will need glasses on your daily basis, not when you're on your laptop.
Okay.
So let me check your pupils right now. I'm gonna come close. I just wanna check your eyelid. Eyelid looks good. The same here. So please look at me.
Okay.
Pupils are round, reactive to light. Good. So now you can keep your head straight and follow the stick with your eyes only. Good. Tell me, when do you see my fingers in your field of vision?
Okay. Now. Now. Now.
Perfect. So I think I will give you a referral to check an optometrist. Your pupils, I told you, they're round, reactive to light. I'm not so worried, but just you had a few mistakes on the reading the Snellen chart, okay?
Okay.
But otherwise, I think everything is fine. It's not so bad, okay?
Okay.
Good.
Thank you.
So I want to check your hearing as well, because it's been a year since I didn't check your ears. I will check inside first, and then I will do a test to check your hearing.
Okay.
So you can relax. Tympan membrane is pro-gray. You have a little bit of wax, but I don't see any redness. So turn your head a little bit on the other side to also check this one here. I cannot visualize this ear because you have more wax. So we have to check next time this ear, and maybe we'll also do a cleaning.
Okay.
Do you have any pain in this ear?
No.
No? Okay, so then let's check your hearing. You can relax and tell me if you feel the vibration.
Yes.
Tell me when it stops.
No.
Do you hear it here?
Yes.
Tell me when it stops.
No.
Good. So tell me what position it's louder, number 1 or number 2?
Okay.
Number 1, number 2.
Number 1.
Good. Number 1, number 2.
Number 1.
Perfect. And I also want to check your face sensation, and I will use this tool. I want to see if you make a difference between warm and cold.
Okay.
So just relax and tell me, how do you feel the globe?
Cold.
Cold? How do you feel it here?
It's still cold.
No?
Yes, it's cold.
Do you still feel it cold?
Yes.
Here?
Also.
Cold. Good. Do you still feel this one cold or warm?
It's still cold. Yes, it's cold.
Cold?
It's cold.
Good. Tell me, how do you feel this one here?
It's cold. Cold.
And how do you feel this?
It's warm.
No?
Yeah, it's warm.
No?
Warm.
No?
Warm.
Perfect. And I also want to do the sharp or dull test, and I will do it a little bit on your shoulder area, if that's okay.
Yes, fine.
So you can close your eyes and tell me if you feel this sharp or dull.
That's sharp. Sharp. That's dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. That's cold. Cold. Sharp. Sharp. Dull. Sharp. Dull. That's cold. Cold. That's warm. Warm. Dull. Dull.
Perfect. So you did wonderful.
Thank you.
You are distinguishing very good the stimulus.
Okay.
So lastly, I want to check your reflexes. So this is going on your elbow. I want to check your reflexes right here. So just let me, can I squeeze your
Yes, of course.
shirt
Let
just
me
a
help you.
little bit? So stay like this.
Yes.
Just relax your arm like this. Perfect. And this one. Good. So keep your hand like this. Wonderful. So now I would like to lay down and I will check your abdominal area, your legs, your feet, and your back as well.
Okay.
Good. Okay, so I'm going to check your hair and I'm going to use this to detangle a little bit, and I'm also going to check your scalp and turn your head a little bit this way. I'm also going to check for any lice infestation. Do you have any itchiness, any redness?
No, I didn't notice.
So I will check shortly and I will let you know. Okay. So turn your head now this way. Everything looks good here. Okay, that's perfect. So I'm going to check the other side now. I'm sorry. Stay with your head like this. Perfect. And Turn your head a little bit more. I want to check it here on the side. Okay. And I'm going to check your scalp as well. You do have a little bit of dandruff, but I don't see any redness. I'm going to check the other side. Okay, that's wonderful. So everything looks great on your hair. So I'm checking your back. Do you have any pain or on your spine or any discomfort?
No, not lately.
I'm also checking your skin for any skin eruption or any redness, inflammation. I do see you have something red here and it's a little bit raised. Any itchiness when I'm touching it?
No.
No?
No.
Do you feel it's raised when I'm doing this?
Yes.
It's like a small raised bump.
Yes.
And when I'm doing like this with my finger, it's a little bit hard. It looks anyway like an insect bite, but we'll also monitor this next time. And if it's getting painful, just let me know, okay?
Okay.
So everything else looks good. I didn't feel any other raised bumps or moles. I don't see any on your back, and that's very good. Perfect. I'm going to check your spine now, and I'm going to check your cervical area as well. How many hours do you stay at your laptop?
8 hours a day.
8 hours?
Yes.
I do feel a little bit of tightness here around your cervical area. I'm going to check your spine now. Just some tenderness around your cervical area. And I think you don't have a correct position when you stay at your desk. Stay more straight. Okay. So this area, it's a little bit bumpy. Did you notice this? Did you had some pain before here?
No.
No? Okay, let me check your scapula as well. Let me know if you have any pain. I'm going to take some measurements now on your back. So I'm just a little bit worried about this area.
What would you recommend?
So I will also try to maybe to massage your cervical area to detension the muscles. And I might recommend an x-ray of your back as well. I'm going to tap on your spine now. Good. So I'm also going to check the how you perceive the stimulus on your back. So tell me if you feel this warm or cold.
That's cold.
Do you feel it cold all the way down?
Yes.
What about now? All the way
it's
down?
cold. Yes, all the way down.
Now?
Yes, all the way down. It's cold.
Tell me if you feel a vibration.
Yes, I do.
Tell me when it stops.
Now?
Do you feel it?
Yes.
Tell me when it stops.
Now?
Perfect. I'm gonna start with some acupressure here on your shoulders, and I will do it here also in the middle. This will help you with the blood flow. Any pain?
No.
How do you feel it now here? Any pain?
A little.
A little bit? I will use also the roller for a little bit of massage of your shoulders. use it here in the middle more. Yeah, so I do feel the tightness when I'm doing this. Do you feel it too?
Yes.
This is an anti-inflammatory cream. I will apply it here on your shoulders and the cervical area. Smells also good.
Indeed.
I think it's plant-based. Massage a little bit more to make sure it absorbs into the skin. That's perfect. Perfect. So now I'm going to use this, and I will do it here on your shoulders and on the cervical area. You will be a little bit red, but in a few hours or by tomorrow you will get better. Okay, let's do it on the other side as well. Let me know if it's too painful, too much. I can be a little bit more gentle.
No, it's fine for me.
Perfect. So try to keep your head a little bit more straight, and I can work here on your neck area as well. Good. Perfect. Perfect. Let me see. Can you turn a little bit this way? It is painful or it's fine?
No, it's fine.
So that's great. So you are a little bit red, but it will go away. Good. So now let's check your feet and your belly. So I'm also checking your legs, and I'm checking the color first. Color looks very good. Let me check the temperature to make sure it's the same. Your knees are very cold. Are you cold right now?
Just a little.
Otherwise, it's the same temperature on both legs. So I'm also checking for edema. Good, so I didn't see any indentation. That's very good. Yeah, so your knees are very cold. Tell me if you feel this cold or warm.
That's cold.
What about now?
Yeah, it's cold.
And how do you feel this?
Cold. Warm, sorry.
And how do you feel this?
Warm.
Okay. Did you had any surgeries in the past on your knees?
No. That's from my childhood.
Okay.
Learning how to bike.
You have a few scars on your knees. Okay, wonderful. So let's check your feet, your toes, and in between them for any redness or eczema. So far, so good. I'm going to check your nails. Nails look very good, and the color is great for both the legs. I'm gonna do some toe spreading. Tell me if you have any pain or discomfort.
It's fine.
Perfect. Let's see this one. Great. Let me check the Babinski reflex. One more time. Good. Going to check the capillary refill. 2 seconds. And I'm going to check the pedal pulses as well. 2+, perfect. So I'm going to check your belly. Did you have any problems in the past beside the surgery that you said on the stomach?
No.
No, good. So I'm visualizing, and your skin is very soft. I do see a few moles, but they are extremely small. And I do see the scar from the surgery that you had. That's right here in the middle. Going to check your belly button. That looks very well centered. Good. So let me check something here. Do you have any sensitivity on your scar here?
No.
No? Okay, that's great. I'm going to do like a pinching test. I'm gonna check your skin. Your skin is very firm. It's looks very good, hydrated. Good. So I'm going to listen to your belly now, to listen to your bowel. So just relax and you can breathe normally. Okay, so bowel sounds normal sounds, and I didn't hear anything else that we should be worried of. I'm going to do some palpations now. Tell me if you have any pain or discomfort, and I will stop. I'm going to check first with your ovaries. All good?
Yes.
Good. around your belly button. Your skin is very soft, especially here around your scar where you had the surgery. I'm going to check the thoracic cage. It's intact. Good. And your liver should be here. Are you feeling all right?
Yes.
Are you sleepy?
Yes.
Just a few more minutes and we're gonna discuss the findings.
It's very relaxing.
So you don't have any discomfort when I'm pressing? Good. Let's check this side. Great. And a little bit more here in the front. And around the belly button and where you had the surgery. Great. Good. So I'm also going to check how you perceive the stimulus on your abdomen. So I'm going to do the sharp or dull test. So let me know if you feel sharp or dull.
Okay. That's sharp. That's dull. 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 Sharp. 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 That's dull. 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 Sharp. Dull. Sharp. Oops, I'm sorry. Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
So I'm also have a sensory brush. So tell me if you feel this on the right or on the left.
That's on my right. Left.
What about now?
In the middle.
Now.
Right.
Now.
Left.
Now.
Left.
Now.
In the middle.
Perfect. And tell me if you feel this.
Oh yes.
How do you feel it?
Like a fresh moisturizing
Spray.
Yeah.
What about now?
Not the same.
Good.
On my left side.
So I will wipe you down. So lastly, I'm going to take some measurements of your belly. I also want to measure
the scar.
How deep is the scar and the belly button, yeah. $44. Good. So let's check here. 12, 13, and here, good. 12, 44, 41. Good. So, like I said, let's you can stand up, and we're gonna discuss the findings.
Okay, thank you.
Okay, Diana. So I'm done with this exam.
Thank you very much.
Also, thank you for coming, for allowing me to do this exam. So, everything looks great on you. You are very young, and I didn't find anything abnormal or something wrong that I should be worried of. The only thing that it's a little bit worried, and you should go to see the optometrist for your eyes, because I think you don't see so good with one of the eye, and I think you should wear glasses on a daily basis, or contacts if it's easier for you at your work.
Okay,
sure. And also for your back, I think it's a good idea to have an x-ray of your spine, because here I did try to massage, but it's very tight and it is feel like it's for a long time, and I think we should take an x-ray.
Okay.
Otherwise, everything was great on your belly. I also checked the cranial nerves. Everything is great beside this. It's not so bad, it's not so concerning, but we just have to make sure everything is fine, okay?
Okay.
And in the meantime, I will give you also some blood tests, like a CBC, a CMP. And if everything is fine, I will see you in 1 year.
Okay, that's great.
Do you have any questions?
No, I think you made it everything very clear.
Okay. If it's something, just call me and we can see each other
Of course.
sooner.
Okay.
Okay, great.
Okay.
Thank you so much, and
Thank you too.
I will see you next time.
See you soon.
Take care. Hi, Mad.
Hi, doctor.
How are you doing today?
I'm really great.
So, I will be your skin specialist for today, and I saw in your chart you came in for some moles checkup.
Yes.
So, is this the moles are concerning for you?
Yes.
So, where are the moles located?
In the back.
In the back?
Yes.
Okay, so I will check your entire body. I will start with your face, with your scalp, with your shoulders, upper chest, belly, feet, and of course also your back.
Okay.
Do you have any other problems, or any itchiness, any rashes that you want to address?
No.
No?
No.
Just the mole in the back?
Yes.
Okay. So I'm gonna start to check your face and your scalp. Like I said, I'm going to put some gloves on. And I'm checking your face now. Your face looks great. I do see a few red spots. can you turn your head a little bit this way? Just like this. So I'm going to check your ears as well and behind the ears. Okay, I do see one here that it's a little bit elevated. This one?
Yes.
Did you know about this one?
Yes.
Do you know for how long do you have it?
Few months.
A few months?
Yes.
Okay. And turn your head on the right side, please. Your skin is very soft and nice. I do see you have some baby hair as well. So that means your hair is growing and it's healthy. So I'm going to check your ear as well. And behind the ears. Okay, everything looks good. Okay, you can return your this. And I'm gonna take your hair. So you can turn now your head a little bit this way. And I'm gonna try to brush it. Is that okay?
Yes.
I have to detangle a little bit so I can check your scalp. Okay. Do you have any itchiness on your scalp?
No.
No?
No.
So I do see some redness. That's why I was asking you. It's right here. I have to check if it's all over your scalp, but so far it's here. Did you recently change your shampoo, conditioner? Because this might irritate your scalp as well.
No.
No?
No.
I'm also going to check for any lumps or bumps if I'm doing a full body checkup. Just turn your head a little bit this way. Do you feel itchy if I'm doing this?
No.
No?
No.
more. Okay, so right here you have something, it's like a red patch. Do you feel this one?
No.
No?
No.
It's not elevated, but it's dry and red. And you said it's not itchy, right?
No.
Okay, your scalp looks very good. So so far I couldn't find anything abnormal, but it's just you have a redness. I think it's all over your scalp. I'm not sure why it's so red, but otherwise your hair looks beautiful. You don't have any dandruff, and I didn't see any bumps or any moles that might be concerning. Okay, so you can turn your head this way now. Okay, relax. I'm just going to feel a little bit. You can relax. I'm sure everything is okay. Perfect. So I'm going to check the left side of your scalp. Everything looks perfect. Sorry. Turn your head a little bit more. So on this side actually it's not so red like on the other side, but then everything looks perfect like it should. I'm not concerned. second position now. So I'm going to check your upper chest now and your shoulders. You can turn your head a little bit this way now. So I saw this before on your neck. You said it's for a few months now, but it doesn't bother you, right? Right. Otherwise, your skin is very soft and looks great. I don't see any skin problems, no rashes. I don't see any bumps or lumps. Okay, turn your head a little bit this way. I just want to check your left side to make sure everything is fine. Do you have any allergies?
No.
Okay, let me check your neck right here. Good. So I'm going to check your back right now, okay? Okay, Matt, so I'm checking your back right now, and of course I see this mole that it's elevated. So did you see a dermatologist before?
No.
No?
No.
So this is so far the only one I can see on your back. Otherwise your back is clear, and I said your skin is extremely soft. I just wanna see how elevated it is. And it's a little bit dark in color at the very top. But it's very soft actually. If I'm touching with a wooden stick, it's soft. So we have to monitor this if it changes in color. Let me check better with the light. Yeah. Let me see. So it's half, 1/4. Okay. I'm going to check your entire back with a wooden stick. I want to make sure I don't feel anything abnormal. Tell me if you have any pain or discomfort.
Mm-hmm.
going to use my fingers to make sure everything is fine on your back. I don't feel any bumps. Okay. So definitely we have to monitor this, and I think it's also best to see a dermatologist. Okay, otherwise your back it's perfect, normal skin color. It's very appropriate for your age. I don't see any other problems on your back. So just you have just this mole that it's concerning. So you can turn around now. I will inspect your belly and also your hands and your arms. Okay?
Yes.
Good. So I'm going to check your skin on your arms, and I will also check your fingers. You can relax your arm, turn it around. Okay, let's check your fingers and fingernails. We have a beautiful color. I'm also checking between to make sure for any eczema or psoriasis, any rashes that might occur. I do see it's a little bit dry in between your fingers, so you might consider using maybe a lotion or a cream, especially now it's winter, it's coming.
Okay.
Otherwise, everything looks good on this one. Great. So let me check the other one, please. So you can just relax. Use the same problem. You see here it's very dry.
Yes.
So if you still have this problem, we have to check better next time or to see the dermatologist. Checking your fingernails. They look very good. Okay, let me see here. Perfect. And on the other side. I do see one here, but it's this is very normal. It's not like the other ones. And one red here. Okay, let me check better. Okay, this is normal. I also have a few on my body as well. Okay, great. So let's check your belly now. I do see one. You have just one so far here, but it's extremely small and it's the same color as your skin. So you have just this one, but it's very small and it's normal. I'm also going to palpate to make sure I don't feel any bumps or lumps, okay? Just let me know if you have any pain or tenderness.
No.
I see a spot here that is darker in color. It might be a birthmark.
Yes.
So it is a birthmark?
Yes.
Okay. I also have one, but it's on my back. Okay, that's great. Any discomfort here?
No.
I'm also going to check your belly button. It's looking great. I don't see any redness around, no tenderness. Just feeling the thoracic cage, that it's intact. So I will use the wooden stick on your entire belly to make sure I don't feel any other bumps. Okay, that was perfect. So lastly, I'm gonna check your legs and your feet. So also I'm checking your skin on your legs. I don't see anything that might be worried. I do see here another darker spot. It's also a birthmark.
Yes.
Okay. So everything looks good and normal on your skin, on your legs. I'm just going to check your toes. I'm also gonna check between your toes because your skin between your fingers was very dry and I really didn't like that. Want to make sure you don't have eczema or psoriasis. So everything looks great here. Your skin is not dry. You don't have any infection so far. And your fingernails look normal. I think this was a cut, but I think it's healing right now. And I'm also going to check between the fingers. Everything looks great. Okay, perfect. Okay, Mad, so I'm done with the exam and everything looks great. Your skin is so soft and perfect, the color. I was just a little worried about the mole in the back, on your upper back, that changed in color on the upper side, but it's also very soft. So I think it's best if you check also with the dermatologist.
Okay.
So otherwise, I didn't find anything abnormal on your skin, no bumps, no lumps. That was the only mole on your back that it's concerning. Otherwise, everything is normal and looks very good.
Okay.
Do you have any questions for me today?
No.
No?
No.
Then thank you so much for coming, and I will check with you then in 2 weeks after you see the dermatologist, okay?
Okay.
Okay, take care. Bye bye.
Bye.